This is The Doctor is In. I'm Dr. Freddie Gomez. We want to make the most out of your telemedicine appointment today, so send in your questions and we'll do our best to answer them. Thank you for joining us. As we approach Mother's Day, we'd like to put the spotlight on moms or moms to be. Pregnancy is a wonderful, life changing experience, but for expectant mothers facing the outbreak of COVID-19, it is also terrifying. Sa sitwasyon natin ngayon na may COVID-19 pandemic, ano nga ba ang kailangan nating malaman at paghandaan to make sure mothers and their children are safe and healthy? Para sagutin ang ating mga katanungan, we have on the show Dr. Martha Aquino. Siya po ang chairperson ng OB-GYN Department sa Asian Hospital and Medical Center. Welcome to the show, Doctor.
Hi, good afternoon, Doc Freddie, and good afternoon to the audience.
Glad you could join us, Doktora. Doktora, anong mga karaniwang dahilan kung bakit mataas pa rin ang maternal death sa bansa?
Well, the usual reason is that there's a lack to access to medical care. When you say lack of access, it doesn't mean that there's lack of healthcare professionals or facilities. It's more like some of these women do not have the opportunity to visit their healthcare providers. The World Health has said that they are supposed to have at least a minimum of 8 consults or antenatal encounters with a healthcare professional to ensure that there will be safe delivery. But then most of the time, it has been recorded they only have 4. So the more visits you have, and the more opportunities for you to disclose to your healthcare provider what's going on, then the more opportunities there will be for them to catch if there are any problems, and so that they can intervene at the time.
Okay, could you share with us, Doctora, what is the ideal scenario for maternity care?
Well, during this time of the COVID pandemic, we do admit that there will be a limitation to the number of in-person or in-face contact or encounters with your healthcare provider. Lots of times you have to consult your healthcare provider through other means. So it has now in the new guidelines has been said that there should be a initial consult by the time that you find out that you're pregnant, which could be done through teleconsult, and then an in-face or in-person visit at around 11 to 13 weeks, then again at 20 weeks, and then at 28, 32, 36, and then 37 weeks, and weekly thereafter until delivery is achieved. There can be lab tests requested, which should be properly timed. Now, there can be variations depending on what the woman needs at the time, the presentation, the signs, and the symptoms. So it's not like a one-size-fits-all, or it's for everyone. There can be variations, but the guideline that I mentioned, that is how what is currently adopted at the moment.
Anong mga challenges naman, Doktora, ang pwedeng harapin ng isang buntis, lalo na ngayon na may ECQ?
Oh, challenges. Well, a lot of our pregnant women actually feel lost. Kasi, di ba, parang they cannot have their usual encounters or consultations with their favorite healthcare provider. You know, pregnant women usually feel more attached to their doctors. Hindi yan kasi katulad ng other specialties wherein parang yung parang you can do without them for a time. Pregnant women usually like to call or visit their doctor even if it's not during at their scheduled time, because there's something going on or they are not sure of. So that is another one of the challenges. And then aside from that one, they are more comfortable with like doing their ultrasound every now and then. But right now, there's already a limit because we have to observe social distancing. And we have to institute proper infection control measures. And then at home, there's also the problem like access to healthy food. Most of the time, I'm pretty sure that they're eating those processed food or those junk food, whichever they have on hand at home. So wala din silang access to that. And then aside from that, there's no opportunity also to exercise. Lots of times kasi akala nila parang they should go out, walk around in the park, but then they fail to understand or realize that they can do it at home. Parang turn on the internet, watch some beginner Zumba or beginner yoga they can dance around the house. Those are actually some forms of exercises already. And other problems that they have is that wala na rin kasi silang vaccination kasi syempre their contact or exposure to their healthcare provider is lost. Kasi lots of all the resources are practically channeled to handling COVID, and then since we want our patients to just stay home, observe social distancing, so yeah, admittedly we do tell them to just stay home. So yan yung, and of course we can't forget, since they're just home, there's also the gender-based violence. So, di ba, parang sometimes when the other members of the family are not as understanding, nababagot na sila, so they kind of get annoyed with each other. So that's not then the start of the gender-based violence.
Now, Dr. Martha, if you could join me and help me answer some of the video questions that were sent to the doctors in. The first question we have is from Shanti Lee Verian. Let's watch this.
Magandang araw mga mamis. Ano kaya ang mga alternative ways para kumonsulta sa mga doctors ngayong may ECQ tayo? Pwede kayang online?
Okay, thanks for that question, Shanti. Actually, Filipinos aren't new to online consultation. It's just that we just have to formalize it. Diba? Marami naman sa inyo dyan, you send text questions or you call your doctor, ask them like, ano bang magandang multivitamins, or I have colds, what am I supposed to do, or what can I take? But then this time, it should be a formal encounter. Because instead of having those usual in-face consultations, you have to do teleconsultation. But then, of course, if your doctor tells you that you must come over for examination, then you must do so. So in teleconsultation, in Asian Hospital, we have this platform that we call e-consults, which you can do by visiting our website, asianhospital.com, where you're going to register and pay, consult at your preferred date with your preferred healthcare professional. So yes, you can do your e-consults.
Now, we have a next video question from Janice Salvado.
Nagpaplano na kami magkabibi ng asawa ko. Advisable po ba na ituloy ito kahit na may pandemic?
So much is uncertain about the way this virus affects us, although it has been said that it doesn't affect the pregnant woman significantly, but getting pregnant at this point may not be advisable. You may want to hold it off. And aside from that, you have to remember that a lot of people are anxious and access to healthcare may be affected at this point.
Okay, so we have to pause for a quick break, but when we return, let's talk about things that you should do to ensure safe childbirth during this COVID-19 pandemic. Stay tuned. Dr. Zin will be right back. And we are back. I'm Dr. Freddie Gomez, and you're watching The Doctor Is In on CNN Philippines. No woman should die giving birth. That's why organizations around the world are working closely with governments to strengthen the access of pregnant women to quality health care. To help pregnant women and health workers, the World Health Organization came up with a safe childbirth checklist. It is an organized, evidence-based list of essential birth practices filled with all the things soon-to-be mothers should do from the time of admission and before discharge. Ano nga ba ang mga dapat gawin kung ikaw ay malapit ng mga anak? Still with us is Dr. Martha Aquino. She is the chairperson of the OB-GYN department at the Asian Hospital and Medical Center. Ngayon, continuing with our discussion, Dr. Martha, no? Anong mga paghahanda ang dapat gawin kapag malapit ng mga anak?
Well, for one thing, you should do your visit or consultation with your healthcare provider. Tell your doctor exactly what you're experiencing so that we know what we're faced with or what we need to handle. And aside from that, ito also a lot of women talk to us about their birth plans. Birth plans just actually encourage women to read about it. Read about the birthing process and what to expect. But it's not necessarily what you plan, yun yung mangyayari. It just gives us the team what you want to happen or what you desire to happen, like whether you want to have anesthesia, what type of anesthesia, do you want to be able to walk around? So all of these things will ease the anxiety of the mother, especially naman din sa ngayon during COVID times. There has been a lot of changes. We don't allow anymore the birth companion inside the labor room. This is now then part of the infection control practices so that to minimize the risk of transmission of the COVID virus. So all of these things you should discuss with your healthcare provider. And then if it's possible, you can also ask them to give you a walkthrough on what's going to happen. Like, for example, when you arrive at the hospital, where do you go to, what do you expect? And then, of course, sasabihan din that you have to fill up, di ba, the COVID questionnaire. Tatanungin yun. The patient and the companion should not get offended once these questions are asked. The design for this is to figure out where are you supposed to be brought to. Can you be in the regular birthing rooms, or do you have to be placed in a special room, the ones with the negative pressure? All of these are designed for the patient's safety and, of course, the safety of the staff and the rest of the patients within the hospital. So that is one thing that should be done. And you also have to tell your doctor exactly what's going on or what's happening. Like, are you experiencing pain? Do you think your baby's not moving enough? You have unusual discharge? So all of those should be disclosed to the doctor. And then just because you're about to give birth, it doesn't mean to say that you have to restrict your food intake. You have to eat, you have to have a healthy, balanced diet. And you still have to remain physically active. It's just like you being fit for the birthing process. Not necessarily it's for you to be able to push well, but then, after giving birth, the recovery part, if you are not fit, then you'll surely have a difficult time during recovery and taking care of your baby.
Now, the ideal situation, Dr. Martha, is giving birth at a healthcare facility. You've explained that very extensively, which is great. But a lot of expectant mothers, because of this whole pandemic situation, because of ECQ, may be thinking about a home delivery option as the way to go. Are there any pros and cons to delivering at home?
Well, a lot of moms may feel safer if they deliver at home. But then let us remember, di ba, as in the old saying goes, di ba, when you're pregnant, parang ang isang paa mo nandun sa may hukay na. So why do you want to deliver at home, especially in this situation? I think it would be a lot wiser if they deliver in an established healthcare facility na kung saan her delivery can be managed well. Now, like, for example, if there's no access to hospitals or I know that a lot of pregnant women are afraid to go to the hospitals fearing COVID, but then COVID is everywhere. So don't you want to go to a place wherein when things go wrong, sigurado kang ma-address ang problema mo. We're not saying that there cannot be any mortality or morbidity once you deliver within the hospital, but at least all of those that can be managed will be identified right away and managed appropriately. Not then just in case that you have no access to a hospital or the hospital that you go to has been converted to a COVID hospital. There are lying-ins all over the city, all over the Philippines. You just have to identify one that is registered with your LGU, meaning to say it has all the appropriate business permits, meaning that it has complied with all the safety standards set by the LGU. It is licensed by the Department of Health, and of course, it is PhilHealth accredited. And finally, you should also ask the midwife there if they have an accredited obstetrician duly affiliated with the Philippine Obstetrical and Gynecology on board, because that will serve as the consultant. Like once there's a problem with the laboring mom, the midwife is supposed to inform the obstetrician of what's happening. So then at least meron ng pagdadala ng paglilipatan ng hospital when the need arises. So giving birth at home at this time is not wise. Right now, the supply of blood is low. Healthcare workers are on quarantine. A lot of hospitals have decreased their manpower. They are on skeletal force. So you have to be in that place already so that they have already prepared for whatever eventuality that may happen during the course of your delivery.
Right. So sagutin po natin ulit ang mga inyong mga video questions. The first one is from Eloisa Christine Borromeo. Let's watch this.
Hi po, Doc. Ano po ba ang mga pagkain na dapat iwasan kapag ikaw ay breastfeeding mom? Thank you po.
Oh, food that you're supposed to avoid. Well, we can say it's still very basic. There's no change, no, whether you're breastfeeding, pregnant, or not even, or pregnancy so being or not even pregnant. Do you know? Let's just answer. What are you supposed to take? I think that's a better way to answer it. I hope everybody's familiar with the Filipino plate. And it is divided into four, although not in four equal parts. One half is for your grains, so that's your carbohydrates, and the other half is for your proteins. But then it's not divided equally. You're supposed to take more of the grains over the protein, and the other half is for your vegetables and your fruits, with more of the portion of that half relegated to vegetables. So sinasabi natin na dapat itong lahat na to ay present doon sa kakainin mo. Hindi yung parang pipili ka lamang. Kasi yan yung kadalasan natin nakakalimutan. Ano? Parang it's very basic. No? Sa, di ba, grade school yan tinuturo yung 4 basic food groups na yan. And then in the Filipino plate, right beside it is a glass of water, just emphasizing to us that the water intake is important. You need around 3 liters a day. And they also said the more colorful your plate is, the better. It means to say it's going to be a lot healthier, more nutritious, supplying you with the right amount or more than the sufficient amount of vitamins and minerals and fiber.
Ang sunod na tanong ay galing kay Mayet Espejo Cariaga. Let's watch this.
Since delikado pa rin na pumunta sa ospital or clinic, advisable pa rin ba na pumunta sa clinic ng OB for regular check-up?
So we're now going to have a new normal here. So as much as possible, you have to get in touch with your doctor or your healthcare provider para malaman ang need, whether it has to be an in-person consultation or you can manage with the teleconsultation. Popping into your doctor's clinic may not be advisable kasi syempre, we have to observe a strict social distancing kasi because we don't want the infection to spread or to spike once again. So this is also a form of protection. Hindi naman pinagtatabuyan ng pasyente o ayaw. Kasi syempre, para lang naman din sa inyo yan. Ayaw naman din namin na kung saan kayo pupunta. Para kang, di ba, si Mother Mary, Joseph na kung saan nagpupunta, hahanap kung saan pwede o sino ang tatanggap sa inyo. So dapat, mag-coordinate lamang doon sa doktor para mag-set ng appointment. So that's going to be a very new normal for us. Because what we commonly experience in our clinics is that patients would just pop in your clinic, even not at the assigned time, because for their convenience. But right now, if you truly care for your health, you should set time for this. Hindi siya sinisingit lamang kung kailan ka libre or kasi you're in the area.
Okay, we have to pause for another break. Pero sa pagbabalik natin, let's discuss the importance of self-care for mothers. Keep it here on The Doctor Is In. We'll be right back. We are back. I'm Dr. Freddie Gomez and you're watching The Doctor Is In on CNN Philippines. At kasama pa rin natin si Dr. Martha Aquino na isang obstetrician and gynecologist. Early in the program, we talked about possible risks of pregnancy and how to prepare for childbirth during this time. Now let's focus on one of the most important aspects of motherhood, yet often neglected, and that is self-care. So how true is this, Doctor? Dr. Martha, why is it important for mothers to maintain me time, especially during this time of quarantine?
Yes, Dr. Freddie, it's very important for mothers to maintain that self-care or me time. Why is that so? So it's not just basically like taking care of the pregnancy per se. That's just one thing. You just follow a healthy diet, take your supplements, see your doctor. But then, ang isa kasing aspect here that we seem to forget is now then the mental and emotional health of these pregnant women. It's a challenging situation kasi diba, there are changes in the body, changes in the relationship, no? Kasi syempre, ang ibang husbands or partners or even like the parents don't understand what you're going through, how uncomfortable the situation is. So that's why the self-care is very important. So, maliban na sa sinabi natin na you're supposed to take your healthy diet, and aside from that, get quality sleep. So that's also another thing that's different. That's difficult. You need around 8 hours of sleep in a day, and you can take naps even in between. Kadalasan dito sa atin sinasabi na huwag kang matutulog kasi magmamanas ka. Kung if your body demands you or desires some rest, then I think that you should take that power nap. And aside from that one, you should do your exercise. So like we mentioned a while ago, it doesn't have to be that high intensity exercise. It's not a competition. It's just for you to expend some energy, feel good about yourself, relieve yourself of the stressors. Di ba, pag nag-exercise ka, natatanggal yung mga stressors sa iyo eh. No? So, ganun siya. And then, of course, you should engage in calming, feel good me time. So, commonly kasi ang gusto natin na me time is parang nakikita natin nakapost sa Facebook, nag-tour, nag-jog, nagpunta kung saan, nag-malling, kumain sa labas. And all of those things are not possible at this point. So maybe we should do what we used to do before. So ano yun? You can engage in embroidery. Parang sounds corny, but actually that's a good idea. Baking. Ang dami namang recipes sa internet, cooking, diba? And then see the magic, right before your eyes. You can transform, something or create something out of nothing. So, diba parang those things are enjoyable. And kung halimbawa, right now that you're pregnant, wouldn't it be great if you can create already all those things that your baby can use after birth, like those mga na-describe nila, diba? You draw your face, yung mga toys, yung mga booties, mittens, ganyan, tahiin mo siya, i-embroider mo siya. So all of those things are parang me time or feel good time for you. And kung sakali naman na you don't enjoy these things, maybe you can stay quietly in a room, read a book, no? Yung mga ganong klase. Or you can also call a friend. Hindi naman kasi kinakailangan parang kayo, magkasama kayo. Diba? Pwede naman kasi paano magkaharap lang, it is as good as that. So meron ka ng kausap. So these are now then the self-care activities that you can do during this time.
All right. That's good. That's good. So last set na po tayo ng mga video questions. Let's answer a question from Regine Samar.
Good day po. Ano po kaya ideal sleeping hours ng mga mommies na may newborn babies para makapagbigay ng energy?
Hindi ko siya narinig.
Sabihin niyo pa ulit.
Can you repeat the question, please?
The question, Doctor, was ano po ang mga ideal sleeping hours sa mga mommies na may newborn babies para makaregain ng energy?
Oh yeah, that's the baby is unforgiving. It has its own time. So ideal sleeping hours. So yeah, when the baby is sleeping, then you sleep along with your baby. Kasi kadalasan na nangyayari, the mothers feel guilty like kung sakali they don't fix the room or wash the diaper and everything. Hindi, when you're caring for your baby, that's your concentration. So pagka natulog siya, sabayan mo na lang ng tulog. Kaso kung you really feel tired, huwag na mahiya. Ask your partner to help you out. Devise a system wherein like parang all of the members who in the family who help you in the care of the baby can parang minimize your your tiredness, no? So it's the same. It's something like around 8 hours. But then if you need more, then please do so. Sleep more.
All right. Sige, we have a next video question from Sheila Guevara.
7 months na po akong buntis. Normal lang po ba na makaramdam ako ng pananakit ng balakang at saka pagiging irritable?
Doc Freddie, what's the question again?
The question was, 7 months na po siyang buntis. Normal lang po ba na makaramdam siya ng pananakit ng balakang at pagiging irritable?
Oh, the back pains are quite usual because of the softening of the ligaments, the baby becomes heavier. And of course, admittedly, marami naman talaga sa atin dito na don't have sufficient physical activity, and lots of times, no, pregnant women don't really engage in some exercises or stretching. So yes, it's usual. But just because we say it's usual or it's expected, it doesn't mean that you're not supposed to bring it up with your healthcare provider. Minsan kasi paano may mga nangyayari na kasi na para when it's too frequent, too severe, then syempre, ma-alert na yung healthcare provider that something's wrong. So baka kinakailangan ng further investigation. Now then, kung sabi kong is it common to be masungit or irritable at that time? Well, it depends, no? If you don't get enough sleep or rest, then it's natural that you get irritable. When you're hungry, because you don't eat enough, you don't eat on time, then yes, you will be irritable. Pero kung so what we're trying to say is we have to get to the root cause for being irritable. You can't just say it's natural to be irritable. Why are you irritable? And let's find a solution to that.
Okay, thank you very much, Dr. Martha Aquino. She's the chairperson of the OB-GYN department at the Asian Hospital and Medical Center. Thank you for all your time and sharing your expertise on today's show. Okay, thank you, Doctora. And of course, thank you all to our viewers and for tuning in to The Doctors In. I hope you learned something from our discussion today. Have a good Mother's Day to all the moms and moms-to-be, and I will see you again tomorrow at 3:30 p.m. only here on CNN Philippines. Stay safe, everyone.